So I'm going to invite up Dr. Kenneth Haynes. Dr. Haynes is our GU pathologist, our expert and sort of leader of the GU pathology program here at Mount Sinai.
It really is a pleasure being here after that wonderful presentation, because it really has revolutionized prostate surgery. In the operating room, we'll have a table. We'll provide you ink, whatever you need. You cut your sections, you ink them, then you send the pieces up to us. We'll serially section them and freeze them. The first case we tried took well over an hour, but over time we got better at doing that, and we got the turnaround time down to the 30-35 minutes. The trouble with letting the surgeon do it is good surgeons are always thinking about what can I do to have a better outcome for my patient. And Dr. Chouari decided, okay, so let's lop off the apex as well. The difficulty with that is with cutting so many surfaces, the connective tissue around the prostate tends to retract, and so it makes the possibility of having false positive margins. Said, okay, so just send up the prostate frozen section area. We'll take it, measure it, weigh it, we'll ink it, and then we'll go ahead and lop off the apex, your posterior lateral margins. So here's an example of the apex. It's been serially sectioned, put on a ruler, taken to the cryostat. We have a yellow streak indicating the apex and an orange streak indicating the anterior. Therefore, if we have a positive margin, we're pretty good at being able to identify where that margin is. We'll submit these basically apex to base, and so we'll know what slice it is. We'll know whether it's close to the apex, mid, or base, whether it's in the, quote, anterior, which is more lateral, or posterior, about even with the seminal vesicle. But a better idea was doing more of a shave instead of just a single slice through it, so we get thin sections that have all the margin that we're interested in. So we found that yes, this is feasible and standard practice in the United States. Our turnaround time is now between 35 and 40 minutes, and we do get a decreased rate of positive margins, so we're down to about 6.3%.